Hi everyone, in this teaching subject, History of Medical and Pharmaceutical Sciences, we're going to start with the first lesson, where we're going to talk about health and therapeutic practices in ancient times, or Antiquity. Together, we're going to take a trip back in time, flying over various famous civilizations such as Mesopotamia, Egypt, India, China, Africa, America, with Aztec and Maya, and we finish with Greece and Rome. As introduction, medical and pharmaceutical sciences have a long history that dates back to the ancient times. The earliest known medical writings date back to the ancient Egypt, where doctors practiced surgery, pharmacy, and clinical observation. Over the centuries, medical knowledge developed in the Greek and the Roman civilization, where famous doctors such as Hippocrates laid the foundation of the modern medicine. In the Middle Ages, medicine was influenced by Islamic and Chinese medicine, which introduced concepts such as human anatomy and pharmacology. After we have the Renaissance period, it saw the emergence of great figures in medicine such as Andreas Vesalius, who published the first book on modern anatomy. In the 18th century, medicine made significant advances in the fields of immunology, microbiology, and pharmacology, thanks to the scientists such as Edward Jenner, Louis Pasteur, and William Whitehead. Since then, medical and pharmaceutical sciences have continued to rapidly develop, with major advances in genetics, drug research, and medical technology. Today, these disciplines are essential to understand and treat diseases, improve the quality of life for patients, and maintain public health. Now we treat civilization by civilization, and we go on to the contribution of everyone to health sciences, and we start with Mesopotamia, which had several dynasties and more than interesting scientific stations. The first period is that of Sumer, and Sumerian thought was imbued with animism, from Latina anima, and that means the soul, a religion that attributes a soul to animals, objects, and natural phenomena. The Sumerians attribute an explanation to the natural phenomena. Man is in the service of gods, and this is synonymous with sin. This is a divine punishment, and only penance could heal and purify the sick, and the art of healing was reserved for the priest-physician. After the Sumerian period, we had the Akkadian period, and they assimilated Sumerian sciences, which correspond to the Bronze Age. After the Akkadian, we had the Amorite, and made Babylon their capital. As the country spoke two languages, scribes wrote dictionaries such as the Code of Hammurabi, which represents the oldest legislation in the world that we know, 1750 BC. The code is engraved in the basalt stele found in Susa in 1902 and kept at the Louvre Museum in Paris. According to this code, doctors who poorly treat their patients are severely punished. Here we have two pictures, which show us the scripts engraved in the basalt stele, the famous Code of Hammurabi, and which kept in the Louvre Museum in Paris. With the Assyrians, who had now the Iron Age, Mesopotamia underwent a profound reorganization where commercial relations were established with neighboring and distant countries. For example, cotton came from India as well as weights and muses, which were imported for the preparation and dosing of medicines. This picture is a sample of Mesopotamian library, and it represents the oldest library in the world, which kept in the Archaeological Museum of Istanbul in Turkey. The next civilization is very famous. It's the ancient Egypt or Egypt Antique. It was famous by the pyramids and other things, especially in the sciences fields. The medical literature of Mesopotamia and Egypt have many similarities because both civilizations developed in a comparable manner, with medicine arising from the same magical and religious thought. However, the difference in geography and living condition, medicine presents some fundamental difference in Egypt. In Egypt, the reason is much more prominent than in Mesopotamia. The Egyptian physicians were great observers of nature and excellent surgeons. The famous Ebers papyrus or Papyrus of Ebers contains numerous formula for medicines and instruments for the treatment of internal diseases, eye disorder, gynecological and dermatological conditions. The Egyptian medicine shone beyond its border. Darius, the king of the Persians, had Egyptian physicians the best in the world. Egyptian medicine had a strong influence on Greek medicine. Now we pass to traditional Indian medicine. Traditional Indian medicine has been in existence for 4,000 years. There are a tribal medicine, Ayurvedic medicine, the Tobal Unani medicine, and modern medicine. The tribal medicine, the traditional medicine of the Dravidian, the first inhabitants of the country. Ayurvedic medicine, it's the medicine of the Aryan, its invaders who come from the high plateaus of Iran and practice the Hindu religion. And the third step, the Tobal Unani or Greek medicine, which is the medicine of the Muslims, and the modern medicine introduced by British. The traditional Chinese medicine. The traditional Chinese medicine has been in existence for 3,000 years. The diagnosis of the illness is based on examining the tongue and taking the pulse. There are 28 different types of pulses. The doctor is also a pharmacist, and the traditional pharmacopoeia comprises about 85% plants and 15 minerals, insects, and so on. The most well-known therapy is acupuncture. It cures what modern medicine cannot, such as chronic pain and facet neuralgia. There are 365 points distributed throughout the body following meridians. In China, the traditional medicine and modern medicine are complementary. Traditional doctor training 5 years, including 1 year at the Faculty of Medicine, and modern doctors training 7 years, including 1 year of traditional medicine. We're now going to take a look at traditional medicine in Africa. The traditional African medicine is widely practiced in Africa. It combines a perfect knowledge of medicinal plants and the psychology of the patient. One is often a traditional practitioner from father to son. After Africa, we're going to take a look at traditional medicine in Latin America. The Aztecs and the Mayans were knowledgeable about medicinal plants and were very skilled surgeons. The profession was reserved for the priests. Now we're going to take a major leap forward in the history of the medical and pharmaceutical science with the Greek civilization and then it's the Roman civilization, where we're going to see the emergence of philosophers, thinkers, and doctors who are going to change the way we think about health forever. In the Greece Antiquity, the medicine and the religion mixed at the start. Asclepius, Greek physician god Asclepius of the Roman during the Trojan War, the god Apollo, god of beauty and the arts, saw the plague in the ranks of the Greek army. To appease his anger, sacrifices were needed. We find the notion of the purification from sin that we have seen in the relationship within medicine, religion, and magic in the Mesopotamian and Egyptian civilizations. Subsequently, the Greek philosophers indirectly exercised a great influence in the medical art. They did not just observe nature, but they saw an explanation and tried to find the cause of the phenomena. Examples: the word pharmacon means both medicine and poison. Everything is poison. Nothing is poison. It's the dose that makes the poison. It's thanks to this radically new way of thinking that medicine is gradually breaking away from magic. Hippocrates symbolizes this revelation. Hippocrates is a Greek doctor born in the island of Kos. As little is known about his life, but century after century many legends formed around his name and his work, which made him the most famous doctor in Greece. Later the schools of Alexandria collected all known medical works under the name of Corpus Hippocraticum. We find in these writings many symptoms observed with accuracy, drug on chest, dietary treatments, theories about the nature of human beings. There is no actual book on drugs. His ethics, the origin of the famous Hippocratic oath that doctors take and was written is probably later. He intellectually revolutionized medicine in ancient Greece and making medicine a profession in its own right. He is recognized as the first physician to have rejected the beliefs and superstitions that attributed the causes of disease to the supernatural or divine forces. Other figures from the Greco-Roman civilization, such as Theophrastus and Pliny the Elder, are also of interest. And if there's one name you should know with the same weight as Hippocrates, it's Dioscorid and Galen. Dioscorid is a Greek physician and botanist, probably a military doctor. Following the Roman armies, he traveled to Spain, North Africa, Syria, and so on, which allowed him to know a considerable number of drugs. He wrote a book titled in Latin De Materia Medica. This work on medicinal plants had a very great influence. This book, De Materia Medica, gave its name to medical matter, a pharmaceutical discipline also called pharmacognosy. It describes 1,000 herbal remedies, the rest animal and mineral. For each species it gives the popular name, description, and properties. This book brings up knowledge of the plants and remedies used by the Greeks, Roman, and other Mediterranean peoples. The other figure, Galen, is a Greek physician too. as a doctor of School of Gladiators. He made important discoveries in anatomy, and he went to Alexandria and then to Rome. He knew well the varieties of medicine plants that he studies before using them. His work enjoyed great prestige for 15 centuries. Galileo had a prodigious influence on the medicine of later centuries. He is the Galileo of Arabic texts. 500 years ago, he was still with Ibn Sina, the Pope of medicine. It is in his honor that the pharmaceutical discipline was named Galenic pharmacy, the science of pharmaceutical operation and pharmaceutical forms. In some European countries, pharmacists take the Galilean oath, similar to the Hippocratic oath for doctors. Well, we have finished with the ancient world. We have had a quick overview of medical thought during antiquity, where it was clearly mixed with magic and no scientific basis until the appearance of Greek philosophers like Hippocrates and Dioscorides, where the reason asserted itself more and detached itself completely. So, in the next course, we are going to take the talk about the Arab Persian or Arab Muslim civilization and its enormous contribution to the world of health and pharmacy. Thank you for your attention and hope to see you soon.